Hello friends, this is Arvind. In this video, I am going to explain about National Population Policy 2000. Right. So coming to today lesson, just we have to recap once what we learned in the last previous classes. So in the chapter number 2, population and human resources. Right, human resource. If you wanted to know human resource, we have to study the population. What are the qualitative, what is the quantitative aspects of population. That's why we need to learn the population. Right. So in that there was a demographic transition, theory of demographic transition. High birth rate, high rate in the first stage, low death rate, high birth rate in the second stage, third stage, low birth rate and low death rate. That's what demographic transition theory which was given by the T.R. Malthus. Right, in his book The Essential Principles of Population, he clearly explained what is a population explosion. Right, if the birth rate is very high and death rate is very fast, it is decreasing. So that leads to the population explosion. So which will be many economic and social problems. There will be many social evils. There will be no job opportunities. Okay, there will be many scarcity in food. Right, the food supply will be increases arithmetic level, at the same time geometric level will increase population. Arithmetic level means 1 2 3 4 5 like that. The population will be increases 10 crore, 30 crore, 40 crore. So that will be very fast increasing the population. The growth rate of population is very fast. So that is what demographic transition theory, population explosion, and what are the population in Indian population futures, which were size of Indian population. At the same time, what are the infant mortality rate, maternity mortality rate, right? What is the birth rate, what is the death rate? So that's what we learned in the last previous class. And what are the causes of rapid growth of population in that economic factors, social factors, and what are the remedial measures to control the population, which were learned in the last previous class. Coming to today's topic is that National Population Policy in 2000. So far we implemented planning, whatever the 5-year family planning system from the 1952 and 1970s. We were implemented that family planning system to control our population. Right. So the population is increasing. The growth rate of population is very fast. Okay, so that to try to decrease population, to control the population, we had implemented many schemes, but still our population increasing very fast. The growth rate of population is increasing very fast. So the government of India come to control the population. How can we control the population? How can we maintain the stabilized population? How can we decrease the infant mortality rate? How can we decrease the maternal mortality rate, death rate and birth rate, and malnutrition, what the reproductive stages, which are all those things to come to know this particular national population policy. And there are the communicable diseases, transmissible diseases, right, like COVID-19. So to control these all the healthy issues, health infrastructure, which all those things to maintain, to control the population, to stabilize in the positive aspect of population. That's the reason why the government of India try to implement this national population policy in 2000. Right. So what is 2000 policy which explain us national population policy? See here, there are three major objectives for there. The first major objective is immediate objectives. Immediate objectives at right time. These are the major objectives which have taken in this national population policy. See, look at here, contraceptions means to control the population we need to take many family planning and many sterilizations things, whatever the to control our birth rate, to maintain the stable population. People have to take contraceptions. Okay, and health infrastructure. Government has to immediate infrastructure, maintain immediate infrastructure each and every rural area. Okay, mandal, rural area, health, clinical institutions has to be implemented in this. Health infrastructure is a major objective, and health personnel, each and every individual, government has to provide health personnel, and at the same time integrated services and basic reproductive. So the basic reproductive stage, while going to give children, the woman has to be take well nutritious food. So what are the things has to be taken, what are the medical treatments, what are the medical issues has to be, the government has to provide well equipment, well medical facilities, all those things provided by the integrated services and basic reproductive and health care has to be maintained, the immediate major objectives in this policy. I am coming to the medium term objectives. What are the medium term objectives? Reduce the fertility rate by 2010. So it has to be replacement. The birth rate, the reproductive age, the fertility rate is very high. Okay, so population is increasing very fast. The growth rate of population is very high. So to maintain the stabilized to slow population, increment the pace. To maintain the slow level of growth rate of population. So that's why the reduce the fertility rate by 2000. It has to be replacement. The fertility rate has to be decreased. That's what by 2010 has to be maintained. I am coming to the long-term objective. What are the long-term objectives which are taken in this subject, in this 2000 national policy? Here, stabilize the population by 2046. Government has to stabilize the population. How it will be stabilized? So following, there are the number of 30 major measures are taken the government of India through the national population policy. So what are those measures? Just look at here. National population policy in 2000, decrease the infant mortality rate. Decrease the infant mortality rate means, what is the infant mortality rate? Every 1000 live children, how many children are going to death? So that is 30. Below 30 children has to be the infant mortality rate has to be there, right? So reduce the infant mortality rate. That is one of the major objective of this particular national population policy in 2010. I am coming to the infant mortality rate. Infant mortality rate means children, whatever the mother, woman while giving delivery, she is going to die because of there is many problems, lack of blood, and at the same time many healthy issues. While giving birth children, she is going to die. So that's what maternal mortality rate. Every 1 lakh live deliveries, how many women are going to die? Right? How many women are going to die? That's what maternal mortality rate. So it has to be decreased. Below 100 it has to be maintained. Based on the 2000 national population, in maternal mortality rate has to be below 100 per lakh of mothers, right? That's what has to be decreased. That has to be below 100 maternal mortality rate. Okay, I am coming to the universal immunization. Okay, immunization means a strength where physically or whatever the health issues, it should not be maintained many issues like medical issues. Okay, so people has to be very active, very healthy. Okay, so universal immunization means better medical facilities, better strength, and physically are well healthy. Okay, how it will be? So the immunization has to be there, universal immunization. Okay, they are right to maintain immunization each and every individual of the people. So that is what one of the most important measure which were taken in this particular 2000 national policy. I am coming to the fourth major important measure here. 80% deliveries in hospitals. 80% of deliveries which has to be within the hospital only, within the institutions, medical places only, with the trained doctors, trained staff of the deliveries. Okay, so 80% of deliveries which should be in the hospitals. Nowadays we are following the primitive and traditional and superstitious and beliefs which are still our deliveries are going on in the rural areas. So which has to be decreased. The 80% of deliveries within the hospitals, the institutions, government institutions, with the clinical institutions, with the better trained staff, trained medical staff only they has to deliver. So 80% has to be maintained. So that is what one of the major measures which are taken in this national population policy. Right. And coming to the here, safe abortions has to be increased. Means the government has to provide safe and facilities. Government has to be provide facilities to save deliveries and save abortions. The abortion has to be very safety. I mean the facilities has to be provided government. Okay, it has to be increased. The government has to be provide facilities to save abortions women and has to be increased. Government has to give more opportunities, more facilities, okay, to abortions. Okay, that's what one of the major issues to control our birth rate. And next, child marriage and prenatal diagnostic techniques. Right. So what is the child marriage? Child marriage means below age 18. Whoever age below 18 years old girl child, they should not marry. Okay, so after 18 years age old girls only they should marry. So it has to be strictly, it has to be maintained. It has to be enforcement. The law which is 1970s, 1903, which was only 15 years, and 1978 it was increased. 18 years old girl, below 18 years old girl should not marry. But still in nowadays, some of the rural areas, there are the age 15 after the 10th, after inter, so they are going to marry. So that's not happening. The law which should be enforcement, strictly it should be enforcement. Right? If they marry below age 15 or 18, so their fertility rate, their level of standard while giving delivery of, there will be many issues. Okay, so it has to be decreased, and population, the fertility rate will be very high, so it has to be decreased. Our population is very high compared to the rest of the world. How can we control our population? So we have to take these kind of measures. Okay, the strictly have to be enforcement the law which is child marriages below 15 or 18 years old children should not be married, girl child. Okay, earlier it was only 15 years. Now it was in 1970s. They are the Child Marriage Restraint Act, which was amended in the 1978 from 15 years old age to 18 years. Okay, that has to be strictly implemented. Still, it is not implementing in India. Right. So that is one of the, and prenatal diagnosis while in the children in her womb or else after delivery, the prenatal diagnostic whatever the techniques, whatever the test which has to be maintained particularly. So that part has to be maintained very clearly. It has to be facilitated each and every perspective. So the child marriages has to be maintained. The child marriage has to be strictly prohibited in this scenario. Right. So that is one of the major issue which are in Indian society. So it has to be decreased. So that's why reason why that will be impact decreasing the population and decreasing the birth rate. Okay. So there will be the education, the girl child education will be increases, so that she can participate economic activity. She's life will be better. So child marriage has to be decreased. Okay. And next, increasing the marriage age of girl 18 to 20. Okay, what we have learned here, 1978, according to the Child Marriage Restraint Act, we have 18 years old age girl can marry. But what 2000 national policy, population national policy, which explain us 2000 national population policy, which explain us, increase the marriage age for girl. Okay, 18 to 20. 20 years it has to be increased. Right. So there was only 18 years. Even though nowadays still below 18 years old they are marrying. People are the family are there. People unforcefully, means they feel insecure. They feel burdened. Okay, girl child they feel burdened. They girl treated as in Indian society as a what we can say debt. Girls treated as a debt and boy treated as asset. So that kind of social evils, that kind of social beliefs, superstitions which were in the society of India. So which were all those things increase the marriage age of girl 18 years old to 20 years. Means till the 20 years she should not marry. The girl child should not marry. She has to be in school or college or degree. Okay, she has to be enhanced. She has to be empowered all aspect, educational aspect, so that she can participate in the economic activity. She will get income so that she will live life better. Okay, she will aware to maintain. She can manage all the family. So that is better option. So 18 to 20 it has to be increase the marriage age of girl, right? So that is one of the measure which are taken in the national population policy in 2000. And coming to the special reward marry 21, means after 21 age, the girl if married after 21 years age old, she can get the reward. So government can provide, government will give special award for that girls. Whoever married after 21 years, okay, so government will give special rewards for that girls. Okay, and contraceptions and second child. Okay, the government of India has implemented two-child system. Okay, two-child norm which were taken in our family planning system. Right. So if you look at the Chinese economy, one or none, that kind of strictly population policy which were in the China, so that the population is decreasing in China. Right. Coming to India, two or none. Okay, two or none. Iddaru leka avasarame ledhu. So so that kind of situation in India. Okay, contraception second child. After the second child, they have to take precautions. Okay, see, they will not give more than 2 children. Okay, so they have to do abortions. Okay, abortion they has to be done after 2 children. So that has to be implemented, that has to be practiced in each and every woman in India. Okay, that has to be one of the major measures which were taken in this national population policy in 2000. And coming to the health insurance and sterilization of 2 children. See here, health insurance. What is health insurance? Means if the children who are women or family, the family size is maintained only 2 children, so they will get insurance. Government will provide insurance that family if the whoever having only 2 children in their family size. Okay, so that's what after 2 children they made sterilization. Okay, they made abortions of their productive activity. So that will be leads to be decrease our population and slow growth rate of population. Slow growth rate means positive growth of population. Okay, so that is one of the major which were taken in this national population policy in 2000. I see, look at here. One more major important measure here. Universal information, the important information which is regarding health, whatever the population, whatever the issues, contraceptions and sterilization, medical facilities, each and every aspect, the government has to be provide information, universal information. Okay, the government has to be maintain counselings with ASHA workers and all. Okay, so there has to be maintained in the different aspects, right? And at the same time, see a counseling and contraceptions. Government give counselings for each and every woman, increasing the population and what are the issues which we will be faced by our society. So each and every prospective government has to be maintained whatever the counseling, whatever the preventions, whatever the precautions, each and everything information which has to be provided to the society, right? So that's what one of the most important. See here, and fifth one, access to information and AIDS and prevention. This is also one of the most important. Whatever the communicable diseases means COVID-19, chickenpox, tuberculosis. So whatever these diseases which were there, so government has to be provide information for them. Government has to be maintain awareness for that particular spreadable, means whatever the infectious issues, infectious diseases what are there in this India. So to eliminate that particular all diseases, government has to be maintain precautions and preventions and give information all that particular uh, diseases and all. Right. And coming to the last most important one is social sector program. Social sector program. Social sector, what are the social sector? Whatever the sanitation, whatever the pure drinking water, whatever the health, whatever the education system. Okay, but these are all social infrastructure. Okay, whatever the welfare schemes, giving whatever the scholarship for the children, so whatever their things, old age pensions, right, and women encouragements, women to while they are adult age, some of the better nutritious food. So all those things will be provided. Okay, social sector program which will control our whatever the stable and nutritious, better, healthy life of that particular woman and all. Right, and family welfare. Family welfare. Okay, to maintain the social sector, so there will be better health conditions will be improved. So that there will be better positive, better standard of their health quality and all. So that will be very good for their health and their next generations and all. And coming to family planning means family welfare. Family welfare, each and family welfare means government has to be provide welfare, their food, PDS, whatever the distribution of all those things. Government has to be provide welfare. If they are unable to access food and all, government has to be provide each and every. And people centered program. People centered program, government, people, each and every individual, government should not reach one particular community, one particular place. Okay, it has to be centered each and every individual of the society to maintain whatever the information, whatever the health infrastructure, whatever the medical care, whatever the all those things, contraceptions, each and every aspect to government has to maintain the better and center program for each and every individual of the society. So far, this is what National Population Policy 2000, which explain major objectives which are contraceptions, infrastructure, whatever the health infrastructure and medical health care. Right. So far, those are the major important and reproductive health cares. And coming to immediate, those are immediate measures. And coming to the medium term, reduce the fertility rate. If they reduce the fertility rate, so there will be chances to slow growth of population. Right. And coming long term, stabilize the population by 2046 by maintaining these are all measures, whatever the infant mortality rate, decrease the below 30 age, and maternal mortality rate below 100 for 1 lakh mother deliveries, and universal immunizations, and 80% of deliveries should be in the hospitals, institutions with trained medical staff. Right. And coming to the fifth, access the information and AIDS, so prevention of communicable diseases, whatever the diseases, communicable diseases, or the government has to be awareness for that particular diseases on that. Okay, each and every individual, the government has to be provide awareness that particular. What are the preventions, what are the precautions for that particular diseases, government has to be give that. And 2 children now. Okay, 2 children now. Okay, 2 children now means every family should maintain 2 children now. Okay, if the 2 children now, government have to provide, if they are poor family, so government has to be provide some economic finance support, right? And safe and the facilities for safe abortions to be increased. Okay, government has to be provide facilities for safe abortions has to be increased. Okay, nowadays many issues are going on, many deliveries while giving delivery, abortions, many health issues are which are going. So government has to provide, people are very poor condition, so that particular things, so government has to maintain facilities for safe abortions to control our population and child marriage. So whatever the Child Marriage Resistant Act in 1970s, which has to be strictly implemented, strictly enforcement, so that we can try to control our population. Means the productive age will be decreases, so that the children will become go to the schools, and they will enlarge their educational outcomes, and they will become well standard of way of thinking. At the same time, after that marriage of 21 years, they will become better way of thinking, and whatever the economic activity they can participate, they will earn more money, so they will compare, so the society will be progressive. So that's what will happen in this. And prenatal, neonatal, all those things has to be, techniques has to be provided in government. And increasing the marriages 18 years old to 20 years, government has to be increased. Means according to the national population policy in 2000, 18 years old age girl marriage has to be there in present condition, but has to be increased to the 20 years. Okay, why it is increased? This the productive age will be decreases. The people, the girl child will be go to the school. She can become well educated. So that will be very better of their girl in their future family and all those things. Okay, she will aware each and every aspect. And special reward for marriage after 21 years. Whoever married, so the girl child will be get special award from the government. And contraceptions, second girl child, so they will have to take care of that contraceptions after second child. And health insurance, whoever done second child, whoever done after second child, so they will they do the sterilization policy and contraceptions which they follow. So that will be, they will get health insurance in their family. So the family size will be decreases. So far the insurance will be provided by the government. And universal information, counseling, all those things, whatever the contraceptions regarding, all this information, prevention, counseling, each and every aspect, government with the staff nurses, each and every aspect, government has to be maintained. Counseling for each and every woman in the rural area especially, right? And coming to the social sector program, social sector programs, so government has social sector, water, pure water, right, sanitation, okay, and health, medical health care, each and every village, primary health care centers, those kind of things, the staff nurse, workers. So government has to be provide regarding the health issues, conditions, whatever the next deliveries or all those things, each and every aspect, these people, government staff has to be maintain, provide all aspects. For example, whatever their health issues, okay, they get awareness each and every aspect. So that is what social sector program, government has to provide drinking water, health facilities, and sanitation, all aspects the government has to maintain. Social sector program has to be increased. And family welfare, people centered, okay, family welfare has to be increased and people centered, each and every perspective, all this society, each and every individual of the rural and urban areas, all aspects government has to make awareness to the children. So this is what national population policy. So I hope you all understood what I explained, this national population policy. If you have any doubt in this particular topic, please make a comment section, and if you please like this video and share. If you're not subscribed, please subscribe and share your friends, so that they can learn something from this video. Thank you.